Hi everyone, thank you for joining me today. I'm Dr. George Arnold. I'm going to be answering some questions specifically related to COVID and pregnancy.
What is known so far about COVID-19 and pregnancy?
So, with regards to what's known about COVID-19 and pregnancy, there's no evidence that pregnant women are at any higher risk than non-pregnant women in getting COVID-19. There's no evidence that they have any more severe disease than if they weren't pregnant.
Is there any treatment for COVID-19?
At this point in time, a number of treatments are being looked at, but there's nothing that's been shown to be effective.
And can I have antibiotics to help with COVID-19?
COVID-19 is caused by a virus, which means antibiotics are not going to help. However, sometimes you can get a bacterial infection on top of the viral infection. So you still may need some antibiotics, but it's to treat the secondary infection, not the COVID-19.
What do I do if I think I have COVID-19?
So there are a couple of different things you can do if you think you have COVID-19. One is to call your family doctor and speak with them. You can also call Telehealth Ontario. They've set up a virtual office. They have doctors that you can talk to that will find out what symptoms you're experiencing and then advise you whether or not you should be tested for COVID-19. If they do advise you to be tested, they'll also advise you where the best place is to go for that testing to happen.
How contagious is this outdoors?
So outdoors, COVID-19 is still contagious if somebody has the virus and they cough or sneeze. So that's why it's important for people to be wearing masks, especially if they're symptomatic. And if you're out walking, you can protect yourself by wearing a mask as well too.
Is it airborne?
At this point in time, we know for sure COVID-19 is spread by droplets. Whether it's airborne spread, still don't know for sure.
I was wondering, since our appointments will be by the phone, how our blood pressure, blood sugar level, weighing will be checked.
What's important is that we talk on the phone. I'll ask you some questions the way I always do when you come to the office. And if there are any concerns that are raised, then we'll set up an office visit so I can see you directly. If there are certain things that come up when we're talking, those will suggest to me whether or not I need to see you in the office and how urgently I need to see you in the office. With regards to blood sugar, actually we've stopped doing the urine tests that we used to do with each visit to check for sugar and protein some time ago because the literature showed it really wasn't that helpful. And with regards to your weight, if you can pop on the scales just before you're due to talk to me, you can give me the weight over the phone. So some of this we can still get over the phone. And the things we can't, we'll check when you're in the office at your next office visit.
Do I have to come to the office for all of my pregnancy visits?
No. There'll be some visits that you do need to come for, and others that we can just do over the phone. There are certain visits that will combine a visit with testing, so typically your first trimester screening, the genetic test we do between week 11 and 13, your fetal anatomy ultrasound, which is typically done around week 19, your gestational diabetes testing done between week 24 and 26, a fetal growth ultrasound done around week 30, your Group B strep swab done around week 35, and then if you get to your due date, we get an ultrasound just to check on the fluid around the baby to make sure it's safe to let things go a little further. Most of the visits in between the ones I've mentioned, we can do over the phone. We'll just check on your baby's movement. I'll ask you some questions, see if you've weighed yourself at home. We can follow along your weight and just make sure everything's coming along the way it should be. When you come to the office, you'll notice a few things that are different. So we're limiting the number of people in the office just to patients. If you come with somebody, no problem. They'll just be asked to wait in the hall while you have your visit. If there are questions they have for me, again, no problem. I'll just call out to you in the hall and we'll just speak over your partner's phone so that you can be part of things if you want to be, and your questions are answered as well. To get into the building, it's a little different because the building that I'm in, the front doors are locked. So we're still there. You just have to go around the next building and enter through there. So that's 377 Church Street, and you'll enter at the entrance by Dale's Pharmacy. When you come in the door, you'll see a screener. They'll ask you some questions. If you're not already wearing a mask, they'll ask you to put one on. They'll give one to you, get you to sanitize your hands. Just head down the hall to the right once you're past the screening desk. You'll come to a ramp on your left-hand side that leads you into my building. The elevator will be on the left. The floor you come in on my building is the second floor. You'll come up to my office on the fourth floor. And then when you leave, same procedure, only in reverse. You'll need to exit exactly the same way you came in.
Can I still get my lab testing and ultrasound done?
So the next question I'm going to answer is, can I still get my lab testing and ultrasound done? And the answer is yes to both. The ultrasound place I typically use in 377 Church Street is still open, taking safety precautions for you, but still providing the same great service. And for those that have been with me for a while, you know I always try and combine an ultrasound with a visit. As most of the other doctors in my building are able to do phone visits for all their patients, I obviously am not and still need to see some patients, just like you, in the office for checks. And we'll combine an office visit with lab work as well. So again, just one visit. And because most of the other docs in my building aren't around, they're working remotely, the lab's not that busy.
If I go into labor, what do I do?
So you do the same thing you would do in normal circumstances, and that's to call the obstetrical assessment unit or the triage unit at 905-472-7366. You'll be connected with one of our labor and delivery nurses who will ask you some questions and then give you advice. So labor and delivery is still open, we're fully staffed, we're operating normally.
Is it safe to come to the hospital?
Yes, it is safe to come to the hospital. We have many safety precautions put in place for you. There are only two entrances that are open to patients. That's the front entrance during the day and the entrance by the emergency department. At night, only the entrance by the emergency department's open. When you come in, you'll be met by screeners. They'll ask you some questions. If you're not already wearing a mask, they'll give you one to put on, ask you to sanitize your hands, and then direct you up to labor and delivery.
Can my support person still come with me for my labor?
One of the most common questions I get asked right now is, what about my support person? Can they still come with me if I'm in labor? And the answer is yes. You're limited just to one support person, but they will be with you during your labor, during your delivery, and for the first couple of hours after your delivery. After 2 hours or so, they'll be asked to leave, and the next time you will see them, unless you're FaceTiming or seeing them online, will be when they come to pick you up. Now we realize that that's not the best thing as far as helping you out afterwards, so we put extra support in place to address that. We're looking out for your safety and for your baby's safety. We certainly realize that you can't do everything after just having a baby, and we've taken that into account. Want to make your stay special and safe.
How long do I have to stay after my delivery?
So with regards to how long you'll be staying after your delivery, typically most women are ready to go at about 24 hours or so after they deliver. Some need a little longer, and if you need longer, not a problem. We want both you and your newborn to be all set to go and for it to be safe for both of you to go when you're discharged. We have a new program that's just started, and it's sort of interesting that it coincided with the whole COVID thing. because we've been working on this for a while, where some women can choose to go at 6 hours after their delivery, and then they will have an in-home visit by one of our midwives the following day to check on both you and your baby and make sure everything's good. So if you're interested in that, the nurse will be discussing that with you after you have your delivery to see if that's something that you'd be interested in and qualify for.
Are there any vitamins or supplements that I can take to help my immune system?
So during pregnancy, some vitamins will be lacking in your system, and that can sometimes interfere with how your immune system works. So there's some vitamins that can actually help support your immune system. Vitamin C, 500 milligrams on a daily basis, is safe during pregnancy. Vitamin D3 at a dose up to 4,000 units a day is safe. Zinc up to 25 milligrams a day is safe. And a good probiotic helps support your immune function as well. A normal prenatal will not have these doses of vitamins and zinc in them. So you can take these doses in addition to your prenatal vitamin. If you find taking your prenatal vitamin along with the other ones I'd mentioned to be taking too many things, over this last while I've been working on combining all of those different vitamins at the doses I mentioned into one. So you can just take one customized vitamin a day, specifically designed for you. For those of you who may be interested in further information, I'm going to leave some more information about this on my website and on my Facebook page.
Can I still have an epidural?
Yes, you can still have an epidural. Anesthesiologists are still working 24/7, providing the same great service they always do.
What if I need a C-section?
If you need a C-section, C-sections are still being performed, and your support person can still be with you during the C-section. So another question I get asked quite commonly is, can I still breastfeed? And the answer is yes. There's no evidence that COVID is spread through breast milk. If you're symptomatic, as a safety precaution, we'll ask you to wear a mask while you're breastfeeding. COVID is spread through droplets. So if you cough or sneeze, that's how you're going to transmit it to somebody else, including your baby. So to help protect your baby by wearing a mask, you can avoid droplet spread to your baby. If you become symptomatic and you're just so sick that you can't breastfeed, then obviously we're going to intervene and help you out. But as long as you're able to hold your baby and breastfeed, that's still the best thing for your baby.
If I am symptomatic, will my baby be taken away from me?
So no, if you're symptomatic, your baby is still going to stay with you. You'll be asked to wear a mask while you're breastfeeding and while you're around your baby, and to just take safety precautions and wash your hands regularly prior to touching your baby. If you get to the point where you're so sick that you can't care for your baby, then we'll provide the help you need for both you and your baby.
Is C-section safer than vaginal delivery to prevent my baby from getting COVID-19?
So at this time, there's no evidence that COVID is spread by your baby coming through your vagina. So there's no evidence that a C-section would make any difference to your baby getting COVID over having a normal vaginal delivery. So for that reason, no. If you were COVID positive, there's no evidence that having a C-section would be any better than just delivering your baby vaginally.
Is registration still open at the hospital?
Registration is still open. It's just happening a different way. So instead of directly coming into the hospital to register, you phone in. The number is 905-472-7373, and then it's extension 7393. They're open Monday through Friday from 9 a.m. to 3 p.m. You'll need to have your health card with you, any extra health information, health insurance through work, along with the registration package that I will have given to you in the office. They'll be just going through the questions on those pages over the phone, so we can still get you registered.
Are the hospital orientation sessions still happening?
The hospital orientation sessions aren't taking place in the hospital, but you can still get all the information you would have received by visiting the hospital website. Again, I'll post some information on my Facebook page because it's a little complicated to actually get to the section that you need to get to. But if you go to the hospital website, look under education, you can follow the trail that'll eventually lead you to childbirth orientation session, and all the info you need is there.
Are childbirth classes still available?
Childbirth classes are available online, and Markham Prenatal has this great 4-week course they've put together for free. So if you go online, go to their website, markhamprenatal.com, and just sign up for the 4-week free course. It's terrific.